I didn't feel disappointed. Being in politics doesn't mean the accommodation of any position. And I have no notes about these things, only memories. Because we cannot predict in Kerala that the government will continue or not.
Hello and welcome to The Hindu. With us today is KK Shailaja, the former Health Minister of the Kerala state. Today, she will talk about the influences that shaped her, the writing of the book, and how she tackled the pandemic that hit Kerala, and also the Nipah virus scare.
I never expected that I will become a political leader or a worker at that time. But mine is my family was a political family, and my grandma and granduncle, I think they are responsible for everything. Kalyani, M.K. Kalyani, and M.K. Ravani, M.K. Damodaran Krishnan, and all my grand uncles were my inspiration at that time. Uh, while I was child, grandma always told the story of her childhood and her youth. At that time, feudalism was rampant. That feudal ideology was rampant in the society. And as you know, the most ugly face of the feudalism is casteism. And caste discrimination was there at that time. And grandma always fought against this caste in those days. She was very brave and loving woman. Same time, she was very beautiful, very brave, and she decision making. She will make decision at once. What is correct, she will right decision at right time. And I'm proud of her because while I was child, all the neighbors I saw admiring her in such a way that everyone is calling either Amama or Ammai or like that Amma. Most of them are calling her Amma. And her story touched my heart while I was little one. Yes, the first thing is I cannot use much time, and I have no notes about these things, only memories. I'm not the habit of writing diaries, etc. And when I remember what grandma told me about this period, um, we have to work out whether the timeline is correct or like that. Always I remember the years, but I cannot remember the dates and that kind of thing. But we worked on that, and because it is not a facts and figure document, it is a story. And the difficulty is that I cannot sit, I cannot concentrate to have this story with Manju Sararajan. And sometimes when I was free, at that time Manju was not free. Manju had two little children, and she had to look after her needs also, their needs also. And that way we cannot adjust the days each other. That is why it become too long. I think almost 1 year and 3 or 4 months when I promised to, after I promised to write this book. I didn't feel disappointed because always my family, my husband, previously my grandma, everyone are saying that working in politics doesn't mean the accommodation of any position like this. And my party also taught from the very beginning, we have some classes that these parliamentary and extra parliamentary works are similar. Sometimes you have to work in the parliamentary arena, and sometimes you have to work in the political section, party work. But at that time, I started so many things. Not I, we can say the government's policies like that. Government decided to have some improvement in the health sector. We started a mission, separate mission called Ardhra Mission. There were four missions at that time, one is in health sector. And while I started my work 2016, I didn't know more about the health sector. I am watching the health sector outside. I am raising some slogans to this should be improved, or asking the government to do something like that to improve public health system, improve our hospital. We want more doctors, etc. That was our slogan at that time. When I take oath as a minister, it became my duty, my responsibility to provide this thing in health sector. And I was lucky that I got a very good secretary also, Rajiv Sadanandan. I mentioned his name here, and we discussed it together at that time. Every time when we discussing about this thing, we were thinking about the duration of 5 years, because we cannot predict in Kerala that the government will continue or not. That 5 years tenure, that was in our dream. We were not taking a long period. How much we can complete in 5 years? But we decided to have some basic change, some basements. That is not for 5 years, forever, to improve this public health system. And we also decided to standardize the thing in the health sector. There was no standardization. It was like a kaleidoscope or an avial, like we can say so. And there are so many taluk hospitals in one taluk, but no proper facilities in them. And the PHCs are in a pathetic condition. I described that in our book. And at that time, when we re-elected, almost in our party discussion, I understood that except CM, no one is continuing in the government. We want to change everyone, to give fresh hands. So the media asked me just when I get out of the secretariat room, the decision come at that moment, and media asked the minister, you are not worried about this, you are not disappointed. I said, no, there is no need to disappointment. They asked, why you are not disappointed? You did this and these things, and you are leading this thing, etc. I said, the person who come, sure he will also lead, no doubt. And I am fresh hand when I acquired this office, when I came this office 2016. I am a fresh hand. I never become a minister previously. I didn't thought like that. Last time, the political situation is very good to LDF. I am also proud of our work. It was a collective work. I am lucky that I can organize all this health sector together. The medical education and the this general medical service. There are two parts in a health ministry. One is health service and other is medical education. Most of the time these two have sometimes no correlation between them, but we are very satisfied that we can make that relationship better at that time. And also I think that we can inculcate a we feeling among the health community, among the doctors, nurses, and in somewhere, I think in some states of our country, the doctor and nurses, they were not coming together. Nurses are nurses, doctors are not. They will not hear, the doctors will not hear the nurses, and nurses will not hear the doctors. That kind of a relationship is there somewhere. Not, I am not saying or everywhere, but in our state, we can join them together to have a mission. And we were doing a mission. When our health transformation mission is going on, at the same time, these challenges also occurred, the Nipah and COVID. During Nipah, we got some lessons out of that. At that time, I came to know that this correlation is weak, and
between medical students, education, and between the
and health services. And when we opened our control room in Kozhikode guest house at that time to attack Nipah, to tackle with the problem. The first day I felt that I make health director convener of everything. But I have to have a different meeting to relate her with the medical college. Medical. I called the principal and superintendent. They were very good persons, and they sit together. I made them sit together and discuss about what is the responsibility of a service and what is the responsibility of this medical college, and they work together after that, and they all feel like we jointly we are trying to tackle the problem, fighting the war, and that was the first victory, I can say so. Yeah, they were calling every night. They were calling, and my the elder son, he was Shobit, he was in Abu Dhabi, but he was very active. I think then me during COVID time, he wore a PPE kit and went to the hospital because he was working in Burjil Hospital, the electric section. He's one of the managers there, and a good position he got. An engineer. And one day she sent me a photograph that he is wearing a PPE kit and going to the positive ward, you know.
Were you worried?
I worried little bit. I worried. I asked him why. What is the need of you to go there? It is for doctors and nurses. You are not either of it, and you are only an engineer. Then oh Amma, you are saying like that. You are a health minister, and if anyone any power failure was there in the isolation room, I can send my juniors or workers there to work. But if I send the workers alone, what will be their feeling? And if he is the manager, and if I go with them, they will be very enthusiastic, you know. And you cannot say so. You are the health minister. He criticized me like that. In the Nipah period, every night he will call me, and my younger son also will call me, Rasit. What is Kannur? Amma, what is the situation? They will ask whether the virus can come from a long distance by air. Is it airborne or not? I said we can say it is airborne, but it cannot travel a long distance through air. Only 2 or 3 meters, you know. Then Amma keep 3 meters away from one day I called them that I am going to Changaruth, the second day. That village, what is the need to go there, Amma? I said the people are worried and they are shifting.
That's where the Nipah virus outbreak started.
Yes, started. And all the people decided to quit the village because they feared that in the air the virus will come to their households. And they were packing everything, and media men called me and said, Madam, they are all packing and they are deciding to go. They decided to go to their other villages in their family friends' house or other houses. And I felt worried a lot, you know, because if they were carriers, they are going to other villages also. They will give the virus to other village, and we should open more war field on that. And how can we arrange this thing there also? At once I told Sarida that I am going to that Changaruth, that Panchayat office, and I will ask the people, don't go. And Sarida said, you cannot go, madam. If the captain fell down first, what may be the fate of the war? We cannot bear that thing. We will go. And I said, no one will hear you, bureaucrats. But elected representatives, they will hear us. They will come there and hear us. And Minister T.P. Ramashan also said, I will also come with you. I didn't want because just after an operation he was coming there, you know, heart surgery. But he didn't, it was his constituency also. He accompanied me and we went there. That was a good moment, you know. Some people are here and here and here, and then They fear to come together, but they want to hear from me and the experts. And we have a mic at that time, and we announced that. And I told myself that don't go outside. We will provide everything to your house, even toothpaste or brush, anything you need. Our volunteers will come and provide it for you, and you should stay here. We cannot understand whether you are developing symptoms or not if you go outside. It is for saving you. If you have any symptoms, we will at once take you to hospital and save your life. Inside my mind, fear is there, that make me angry. And only first time when I become angry, the medias and social media started to abuse that family, bullying them. And at the same time, I made up my mind, and I had a statement at that time: don't disturb them. It is not their fault. They are also fearful, because the family wanted their son to get a job there in Italy. They came here only to meet and greet the relatives, and at once, and some certificate they also want to get from the authorities. Sometimes I will become angry because for when I ask some officers to do something, they will come to me offhand, and without the answer or without doing that job well, I become very angry, and sometimes I will burst out. And one thing you read in the book, that when I visited the general hospital, when I saw these kind of dirty things there, yes, I can't bear, because they can do it. It is
lack of intent,
not money, not money, manpower, not the lack of intent. That make me very angry. One day, a man called me, and I didn't wrote in the book that there was even a wheelchair in front of the casualty. We are taking our relatives to the room, you know. At once I called them to my office. I asked them, have you not enough wheelchairs there? Oh, yes, madam, we have. Have you not the workers who were responsible to pushing it? We have there. Then what happened? A man is a poor youth is pulling his mother, taking his mother in the wheelchair himself. And what is the need of the staff and these equipments? I shouted at them. They became shivering. And that was different face of me. And sometimes the officer said, you have another face, madam. Always they found me laughing at them. Not everybody, not everybody. Someone suspect. Oh, this is our Shailaja teacher. Can she do this much? It is not like that. It may be a PR work, but they suspect like that. They never be dare enough to say in front of me. Then I will give the answer definitely. I'm not the this kind of a what we can say a light, quiet woman always. I am that because from childhood itself, that was my texture or my lifestyle is like that, being calm and quiet. That grandma taught us, be calm and quiet and not quarrel with others or like that. But inside us, there was a person. No one can disturb that person. No one can bully that person. We are also same. We have same power as man. If man can do, women can do. The first part, someone advised me, don't rely on these bureaucrats. They will cheat you. They will cheat you. You should listen. Then I answered to that woman and that person that I am a grown-up woman. I am not only that. I am party central committee member, CPIM central committee member. I am same as the man. I'm not little than any man, and no bureaucrats can cheat me. If they try to cheat me, then they will know what happens. I will throw him out or her out. So I am listening, and you can find out what I am going to do, and I will never bow my head in front of a officer or that, but I will respect them. I respected them, and they said, even my officers said, "Madam, why you are writing about us? We are faceless." The bureaucrats, Rajan Brigade and Rajiv always they told me that, "Madam, don't appreciate us in public. We are faceless. The bureaucrats are public. No one appreciate the bureaucrats. We are doing everything, but all the credit goes to the minister and the government. And that is the thing. That is the actual thing. Why are you praising us?" The parents should give equal rights to girl child and boy child. They should not be desperate that their child is a girl child. Girl and boy, that is similar. Should give equal opportunity to girl and boy. And one thing also, education. What is for education? Some parents are saying education for boys is to get some job and save the family. And education for girl child is to get good marriage to a very good couple to her. And that is why they are educating the woman. Most of the parents are saying that. That is not correct. Parents should educate boy and girl for their own reliance. They should be self-reliant after all. It is not for look after mother and father. It is not for looking after the family. It is to develop their personality, the child's personality. They after 18 years old, they should be self-reliant. And I'm of the opinion that the parents should discuss about the family matters to the children, definitely. Democracy should start from the home itself. Democracy means equal opportunity. That should start from the home itself. But unfortunately, the most of the homes in our society is the unit of the capitalism. The beginning, after my marriage, every time Bhaskaran is buying saris for me. She is she's selected. Now it is like not like that. Every time, everywhere, wherever he went, he will buy a sari for me. And almost all saris were green colored. Once Comrade C.S. Sujata called my husband, when she met my husband, Bhaskar Master, if you buy green saris again, we will take action against you. Every saris were green. Any green patch will be there. That they were beautiful saris, but almost same thing. And after when I became MLA and when I went outside, I started. I am not familiar with this shopping and other. We have no time and no shops at that time in our place. When we are free and I am not fond of and I am not good in selecting these things, shopping sarees. But later, when I went outside, I started my selection. Sometimes it will become good, sometimes bad. But I like my passion is the cotton saree with borders. Everywhere I am looking for the cotton sarees, especially white and off white. If I got it, that is my pleasure. That is my pleasure. That with borders, cotton saree with borders, and using starch also. If we use starch, it will become stiff there. Morning to evening. Someone is asking, what is the secret that you wear the saree in the morning and in the evening it also look the same thing. That is nothing but the starch. I started well the saree, and I'm not fond of silk sarees, but today I have some silk sarees also. These daughter-in-laws, they will any marriage in their family, they will present a sari to me, and wherever they are going, they will buy saris for me. Both of them, my elder daughter and younger daughter also. But I am loving this cotton sari from the beginning itself. Now also. No. That also we have a very good discussion. When they send a email to me that I don't know who recommended me to the Magsaysay.
All over the world, people
Magsaysay award. It is not by application. Not we. I will never send an application for an award. I didn't like it. But anyway, someone may recommend me for that award, and they send a letter that they selected me for this award. And I feel proud at that moment. But I searched what is the background of these things, as a communist. Then I found that previously this Raman Magsaysay destroyed the communist parties in Philippines, and hard attack, cruel attack on them.
Thank you for joining us. For more videos of this kind, please subscribe to The Hindu.